back to Quick Nursing Shorts with Smita, and today I'm going to talk about appendicitis. So, appendicitis it's another GI disorder. It's an intestinal disorder, and usually asks for 5 marks as a short essay type of question in GNM and your BSc exam. So here in this picture you can see this area, this projection, this finger like projection, this is appendix. Okay, so when infection or inflammation is happening over here, it is called appendicitis. Okay, so we will see what is appendix. So appendix is a small finger like appendage about 10 centimeter long that is attached to the cecum just below the ileocecal valve. Okay, so it's a finger like, excuse me, so it's a finger like organ, and the appendix usually fills with the food and empties regularly into the cecum because it empties inefficiently. And why it empties inefficiently? Because its lumens are small and the appendix is prone to obstruction and is particularly vulnerable to infection. Okay, so definition says that appendicitis, itis word indicates inflammation. So it's an inflammation of the appendix, a finger-like shape pouch that projects from your colon on the lower right side of your abdomen. So the appendix is located on your lower right quadrant. Okay, so causes, the reason why this appendicitis is happening, so it could be because of a blockage can be due to a fecalith is a dry hard stool, or maybe a tumor, or maybe a food particle. So when a blockage in the lining of the appendix happen, it will cause appendicitis. So bacteria will rapidly multiply over there, and it will cause the appendix to become inflamed, swollen, and also there will be pus formation later on. So the pathophysiology says that due to obstruction there will be continuous secretion of mucinous fluid. So the mucinous fluids are continually secreted over here to expel out that content of fecalith which is held on in your appendix region. Then there will be increased intraluminal pressure. So due to increased intraluminal pressure, this will also is a mechanism of expelling that particle or fecalith or that dry hard stool out of the appendix into the cecum. So these things will happen in order to throw out that, but when it fails to happen, there will be a collapse in your draining vein because it got stuck and lumens are very small in the appendix region. So the draining vein or maybe the circulation system will be collapsed over there. Due to that, there will be ischemic injury. So ischemic injury means there will be a lack of blood supply over there in that appendix region, leading to bacterial proliferation. So when there is a loss of blood supply and lack of blood supply, there will be eventually bacteria will catch infection over there, and bacteria will rapidly multiply, and there will be a huge infection formation. So due to this infection, there will be inflammation and edema in your appendix causing appendicitis, which will later on have a pus formation or something like that. So this is it about the pathophysiology. Moving on to the clinical manifestation. So the signs and symptoms says that there will be a vague kind of epigastric or periumbilical pain which will progress to your right lower quadrant pain where your appendix is located. The patient may also have hyperthermia, which is a low grade fever, then nausea, vomiting, followed by loss of appetite or the anorexia. And there will also be a local tenderness in the McBurney's point. So McBurney's point is the point where your appendix is located. Okay, so your appendix location is your McBurney's point. So when small pressure is also being applied in your McBurney's point, there will be a local tenderness. There will be um, it will be tender to touch. Even to touch, there will be a lot of pain patient will experience. Then there will be a rebound tenderness. So rebound tenderness means production or intensification of pain when pressure is released. So here when you are giving pressure, patient will not be feeling that much of pain, but when you will slowly take out that pressure and release that pressure, patient will feel a severe pain. That is called rebound tenderness. Then having Rovsing sign. Rovsing sign is something when you where you can perform on your patient. You just have to palpate the left lower quadrant of the patient, which is the opposite side of the appendix. Okay, you have to give a small pressure on left lower quadrant, and that will cause pain in the right lower quadrant of the patient where your appendix is located. Okay, so this is a kind of diagnostic criteria which we do in appendicitis patient to find out whether it is appendix or not, because this thing is not seen in any other condition. Now, if the appendix has ruptured, the pain becomes more diffuse because the appendix is very small structure, and due to inflammation, the lumens will get inflamed and the content in it may get exploded or may get ruptured, and that will be difficult to treat later on, and the pain will become so severe in that case. Now, the complication. So the first complication is a rupture appendix. Rupture appendix is that when the infection spread throughout the abdomen. Okay, so in that case there will be sepsis, there will be infection, there will be peritonitis. Peritonitis is when the inflammation is happening in the peritoneum, which is the layer covering of your peritoneum. Okay, so possibly life threatening. It could be a life threatening situation, and it require immediate surgery to remove the appendix and clean your abdominal cavity. Otherwise the whole organ in your digestive tract will get infected. Okay, also, the second says that second complication could be a pocket of pus that forms in the abdomen. So, if your appendix is burst, you may develop a pocket of infection called abscess, and in most cases, a surgeon drains the abscess by placing a tube through your abdominal wall into the abscess. Okay, so when there is a pocket of abscess has formed in your stomach due to due to a rupture appendix, in that case a doctor or surgeon will uh, introduce a tube inside your abdominal wall to that abscess just to drain out the content from there. Okay, so the tube is left in place for about 2 weeks, and the patient will be given antibiotic also to clear that infection. Okay, so assessment and diagnosis, starting with our very history collection. Collect the history, what type of food patient is eating, what type of profession he is indulged into, and his lifestyle and his medical condition, and many more surgical history, and every history you have to collect from the patient. Then moving on to the physical examination. So in physical examination, nurse has to assess a lot of things, which is Rossing signs, soft signs, obtruder sign, guarding, rebound tenderness, digital rectal exam, and also pelvic exam will be done in this physical examination for appendicitis patient. So these seven things are usually asked for 5 marks question and 2 marks question separately, and they will not just ask write about appendicitis, but they will ask you about the diagnostic criteria of appendicitis. In that you need to write all these signs what you are performing on the patient to find out this appendicitis. Okay, so I will take another class only on these tests and physical examination in another session. So here I have just gave you about assessment and diagnosis, these things just in a heading way. So then you have to take a blood test just to find out there will be increased WBC, the leukocyte will be increased due to infection. So go for a blood test for the patient. Then urine analysis may also be required to find out any infection or maybe the ketone or other urine and urea level elevations. Then ultrasound is done to see the rupture or maybe where the infection is, so you can find it out in the ultrasound. Then x-ray is also done for the same reason. CT scan, we can perform a CT scan to visualize very clearly where the infection is, and what all the area are involved in this infection. Okay, MRI is also done for the same reason, to get a clear picture and visualization of your internal organs. Then, so this is I have taken from my book. This picture you can see McBurney's point over here. So this is your McBurney's point. This area is your umbilical region. From here you need to come obliquely downwards in your lower right quadrant. That is your McBurney's point where your appendix is located. Okay, so this is your iliac spine and this is the cecum. So just below the cecum is appendix. Okay, in your right lower quadrant. it is. So stomach is divided here. You can see in this right lower quadrant your appendix is located. Okay. So in Rossing signs, we are applying pressure on the left side, and when the pressure is applied over here, the patient will feel pain over here. Okay, that is the Rossing signs we do. Okay, so I hope this picture gives you clarity. Now, moving on to the medical management. So, medical management says that surgery is indicated if appendicitis is diagnosed, okay, because there is always a chance of appendix rupture, which we do not want in any case to happen, because later on it will cause many other problems, because once your whole organ is being infected, that will be very difficult to treat. Not just a small organ, that will cause your intestine, your stomach, and your gallbladder, pancreas, liver, every organ will come, will get infected, and then sepsis will happen due to rupture of appendicitis. So surgery is our first priority, then to correct or prevent fluid and electrolyte balance and dehydration. So other than that, you have to focus on your on the symptoms or the problem the patient is actually facing that time. So if the patient is having fluid loss, then in that case you have to correct that by giving IV fluids and start antibiotics when the because it's an infection case. So in that case you need to start with antibiotics and IV before the surgery, before that patient goes for a surgery. Okay, then analgesic is given for a pain, because in appendicitis patient will have a severe pain. Now surgical management says appendectomy. The word ectomy means removal. Okay, so there will be a removal of the appendix, and this happens to decrease the risk of perforation. So as soon as we get to know that the person is having appendicitis, and it's we will not wait further, and we'll just go on for an appendectomy. Till then the patient will be having antibiotic therapy. Okay, so it may be performed under a general or a spinal anesthetic with a low abdomen incision, or maybe by a laparoscopy. So we can just perform it by making a very small incision, and also it can happen by a laparoscopy. Okay, so nursing management says that our goals include relieving pain. So patient is in pain, so you have to give patient a diversional therapy, also analgesic, which is prescribed by the doctors, administer medicines. Now prevent fluid volume deficit, so you have to start the IV infusion, ask the doctor and start with that with the prescription, and also go on for antibiotic therapy, because we don't want person to get further infected. Then reduce patients' anxiety by talking to them, give them psychological support, eliminating infection from potential and actual disruption of the GI tract. Okay, then maintaining skin integrity in case of any diarrhea or nausea or vomiting, or if the patient is facing any such problem, then in that case you have to make that patient body clean, and you have to protect their skin integrity. Then attain optimal nutrition. Such patient will not feel like eating food, then in that case you have to teach them the importance of taking food, and also start IV if not possible by mouth. Then preoperative care. So before operation, the nurse will prepare the patient for the surgery, take the patient consent, explain the procedure, what all things gonna happen, and talk about the anesthesia if the patient is gonna have anesthesia during the surgery, and explain that too, take consent for that. And if there is any evidence or likelihood of paralytic ileus, in that case nasogastric tube will be inserted. There is a chance that patient may get paralytic ileus. In that case the ileum region of the intestine will get paralyzed, so there will not be any peristaltic movement over there, the food from there. So that is the only passage, the food will not run forward. That will cause again a problem. In that case we will have nasogastric tube insertion. So an enema is contraindicated in this kind of patient, because there is always a chance that it can lead to perforation. So never go for an enema in appendicitis patient before surgery. Now post-operative care is place the patient in a semi-Fowler's position, so it will also help them in reducing pain, And also the organ, abdominal organ, will not be having too much of pressure on. Okay, so there will be less tension on the abdominal organs and also the incision area. Now you have to give them some opioids like morphine, so it's a solid it's an effective solid painkiller. In this case, after the operation, we are giving them morphine sulfate when it is prescribed. And if the patient is able to take things by oral, then start oral fluid slowly. And also, if the patient is dehydrated after surgery, so keep on giving them IV fluid, and check out their electrolyte levels. Okay, so food is also provided when the patient is able to swallow it. And when it is time to give the food, the doctor shows you a green flag. Okay, start with the food. Then you can give patient food by oral. Then nursing diagnosis is acute pain related to increased peristaltic and GI inflammation. Then deficient fluid volume related to diarrhea and nausea, imbalanced nutrition less than body requirement, also activity intolerance related to fatigue. So this is about nursing diagnosis. Anxiety, ineffective coping, risk for impaired skin integrity, risk for ineffective therapeutic regimen. Okay, so I have wrote a lot of nursing diagnosis over here, and you can take the same nursing diagnosis to many other conditions if you want to, and if it is relevant. Okay, so thank you for watching my video, and if you like it and if you can relate it, if it's useful for you, do like and share to your friends and subscribe to my channel. If you have any other doubts or something, you can just write down in the comment section and I will just come up with the solution of it. So thank you, have a great day and study well.